Well, hello, everyone. I'm Joanne Marr, President and CEO of Oak Valley Health, and that includes Marr Hospital, Uxbridge Hospital, and our Reactivation Care Center. I'm really delighted to be speaking with you all this evening, and I'm going to kick off the evening with some discussion about our new strategic plan, and then we'll be joined by Elena Pacheco, our VP and Chief Operating Officer, who's also our executive lead for the redevelopment of our Uxbridge site. This is a really exciting project, and I'm sure that you will be very keen to hear more about that. We do have time throughout the presentation for questions, but please don't hesitate to put comments or questions in the chat at any time over the next hour, and we'll work at addressing them. I'd like to start off our evening with our land acknowledgement. Oak Valley Health honors the traditional territory of the closest Indigenous communities, the Chippewas of Georgina Island and the Mississaugas of Scugog Island. The Haudenosaunee and the Anishinaabe have lived, worked, and existed on this land from time immemorial. This land is covered by Treaty 13 signed with the Mississaugas of the Credit and the Williams Treaty signed with many Mississauga and Chippewa bands. We acknowledge that Indigenous peoples were not asked to share their territory with settler populations and that we're all here as uninvited guests. We acknowledge and thank all generations of Indigenous people across Turtle Island for their commitment, contributions, and protection of the land and its resources. Just a note about our land acknowledgement journey. We've had our land acknowledgement in place for a number of years, and we're just about to embark on a refresh exercise. And it's really, as intended to be, has evolved all of our conversations. And so it's time now for some needed change. So stay tuned. So with that, we'll jump to our first update of the evening. The past 4 years have brought us unprecedented challenges into the healthcare system. And as with any challenge, there's opportunity always. The opportunity to demonstrate transformational leadership, to try new things, to be bold and courageous, to establish new partnerships that will contribute to improving the health of those we serve. And to help chart our path forward, we went on a journey of significant engagement, not only with the people who work here at Oak Valley Health, but the patients and the families and the community we serve, as well as all of our community partners. And we asked really tough questions like, how are you going to create an extraordinary patient experience? Why should I choose to work and grow my career here at OVH? Why should learners choose Oak Valley Health for their training? And how do you work with other healthcare services in the community? So what do we mean exactly when we say integrated care? And then that's our vision. We all know that parts of the healthcare system can be quite disconnected at times. And when things are well coordinated, it's often because of the valiant efforts of individuals rather than the structure of the system. Specifically, we know there are disconnects among the parts, including acute care and hospitals, primary care, home care, and home and community care and services, long-term care, as well as other parts of the system. And with our vision, we want to look beyond where we are today and focus on our future, our vision, integrated care for healthier communities. So integrated care is the systematic coordination of care that brings together different organizations, healthcare professionals, and service providers at the right time in order to support the continuity of high-quality holistic patient care, making the patient's journey through today's complex healthcare landscape easier to navigate. It's people-centered by ensuring that individuals' needs and preferences guide the approach, and this requires continuous engagement, strong partnerships, as well as a shared commitment to success. Now, we learned an awful lot, as did many of us through the pandemic and our last strategic plan, about what was needed and how to make some of those changes. So we will be more focused and intentional about how we actually do that. We're really proud of the successes of our previous strategy, Care Beyond Our Walls, and how it guided Oak Valley Health through some of the most difficult days of the COVID-19 pandemic. And now we look to the future in a much more focused and intentional way. Our future is high quality integrated care. We know that the healthcare landscape continues to change rapidly, and we really look forward to leading the way in reimagining what the delivery of care can look like. Hospitals and community-based health services and providers need to work hand in hand to make sure that the journey for patients and families is seamless and that we're improving health outcomes along the way. So what does that actually look like? Patients can access the care or the services they need when they need it. Connections among providers and services are seamless, and information is accessible and easy to understand, and it's shared among patients and providers at every step along the way. In order to achieve our vision, we'll stay focused on three key priorities. Our people. Without them, we can't achieve any of our goals. And so this means recruiting, retaining, and prioritizing the people who make our honor to care culture so special and bring it to life. Through connections, addressing challenges with creative solutions as well as partnerships to help us achieve our goals. And through growth, growing our programs and services as needed, our academics, as well as our space, all while keeping innovation at the front and center and in mind. Our mission has evolved also and clearly identifies why we exist. And of course, we're a hospital, so we exist to provide care. So to provide care for patients and families, and specifically to make that experience extraordinary through our honor to care culture. Now, all hospitals want to provide a good patient experience, but at Oak Valley Health, we are committed to delivering an extraordinary one. And this means that what matters to patients, families, and caregivers is truly valued. And we're committed to consistent, safe, high-quality care that's delivered with empathy, compassion, respect, and great communication. As part of our co-design approach with our patient partners, also known as patient experience participants, we work to create the following definition for an extraordinary patient experience. At Oak Valley Health, an extraordinary patient experience means that what matters to patients, families, and caregivers is truly valued. We are committed to consistent, safe, high-quality care delivered with empathy, compassion, respect, and good communication. We'll implement policies and practices that lead to the delivery of an extraordinary experience for all of our patients every time they receive care. Values are foundational to any exercise, and development of a strategic plan is no different. And one of the activities we engaged in early in the process of strategy development was to affirm and validate our values. And these values represent our culture, our norms, attitudes that we see reflected with patients, with partners, and with each other. And by living our values every day, we demonstrate our honor to care culture in action. It's also really important for us to highlight how our commitment to consistent, safe, and high-quality care and an extraordinary patient experience is woven through or interconnected with everything we do each and every day. The success of our strategy is supported by key elements that at any given time can be enablers, they can be accelerators, or they can be both. Maintaining financial health enables us to provide high quality care to the patients and the communities we serve, as well as to invest in new programs and services or to enhance existing ones. We achieve this by transforming how we do our work through innovation and adoption of technology, and by advocating at local, regional and provincial levels for strategic, sustainable operating investments, as well as infrastructure renewal, as well as collaborating with our hospital foundations in order to create compelling cases for support. Technologies such as those that make virtual care possible can enable connectivity for patients and providers alike, while at the same time accelerating integration. Equipment enables healthcare delivery, and state-of-the-art equipment can accelerate care delivery in today's modern world. And every day, we collect data and information that enables us to support the health system. The use of predictive analytics, as an example, enables providers to anticipate changes in health status or in patient activity much faster, sometimes before there are any obvious signs or changes. So how do we tie all of this information captured in a new plan together? And I'm thrilled that we've created our first ever web-based strategic plan to help map our path forward for our people and for our community. As you start to explore our strategic plan, you'll see some really and truly extraordinary stories that illuminate our path ahead. These stories capture examples of the exceptionally talented and dedicated staff, physicians, midwives, volunteers, and learners who live and breathe our Honor to Care culture. We've also included a summary of the plan in a PDF format because we know sometimes people like to print or download a copy. And that summary is also translated for all in top languages that our patients and families seek interpretation services in, as well as in French. As part of the launch of our new plan, I'd like to share a video that our communications teams created that further illustrates and celebrates our new plan. So I hope you enjoy it.
Woven through everything we do is our commitment to consistent, safe, high-quality care and an extraordinary patient experience.
I'm Anthony Ladelfa.
I'm Elaine Richard. I'm Nicole DiPaolo.
I'm Sarah Pereira.
My name is Stacia Gabidon.
I'm Trina Matthews.
I am Honor to Care.
Really hope you enjoyed that brief video, and happy now to open up the chat for any questions you have. Just again, click on the chat box on your Zoom screen and add in your thoughts or questions.
So maybe I'll just jump in quickly, Joanne. It's Courtney Sorger here on the senior leadership team with Joanne and Elena. And I am actually looking at the chat box now, Q&A. So yes, please go ahead and just enter in any questions that you have. And I know we now have stopped screen sharing, so you can see Elena and Joanne, and then we'll return to the slides during Elena's update on Uxbridge, on the Uxbridge Hospital and the redevelopment plans. So I just thought maybe, Joanne, while we wait for some questions to come in, or maybe before we move on, we could, just maybe address a few things that have come up during the launch of our new strategic plan. I know we've had some questions around, how do we address growth when we hear that there's financial pressures in healthcare? And so how are we looking to do this?
Yeah, that's a great question. It's one I hear almost daily, Courtney. For sure, there are no end of financial pressures, and we're all experiencing those throughout the system, which is, I think, why it's so important that we have a strategy or a plan, because strategy and planning is all about making choices. And so it really helps us more now than ever to focus and make really intentional and wise choices about how and where we're going to invest resources.
And then what would we do, Joanne, if we did over time see that, the path we've mapped out in certain areas is proving to be ineffective? What would the next steps look like for that?
Well, first off, I think that the plan's pretty good because it's based on input from, a lot of very wise individuals, but also our experience over the last strategic plan and through the pandemic. So I think we're on the right path. Having said that, you're absolutely right that, not all of our bets will be accurate. And I think that the beauty of our strategy is that it allows us to pivot and change direction. So if we're moving in one direction and it doesn't prove fruitful or successful, we'll change course. And so we have a lot of that dialogue all the time. And I think being nimble and flexible is really a critical part of strategy execution.
And actually, Joanne, on that, we've got a really good question that came in on those lines in terms of, how do we know, how can we share more about how the data and analytics are used for predictive planning?
Yeah, so predictive planning, a great idea. I mean, just a really simple example is we know from data analytics at what times our emergency departments are going to be the busiest, what days of the week, et cetera, and we can staff and prepare accordingly. So, that's just a very small and simple example, but we have a lot of information and we can use it for predictive purposes for planning service, planning resources to support services, and, much, much, much more.
And so, Joanne, another good question in from the community here. Thanks for sharing the strategic plan. What problem areas are top priority for you to address? So that's a great question.
Well, I think financial uncertainty, again, as in the first question, we have to be prepared to invest wisely. So the strategy really helps us with that focus in order to support growth and capacity and pressures, and addressing the growth and the service needs are critical. Again, important that we make wise choices. I think that, our innovation platform, adoption of technology will help us with another critical priority, and that is how do we attract the right talent? Because without the people and without the ability to keep the people, we're not going to be able to achieve our goals. We can't deliver on our priorities. We can't deliver on our strategy. So I would say those are some of the top priorities.
And one question also, Joanne, from when we launched, and I know that it was a question for one of our patient experience participants, was really about our vision, and is it bold enough?
Yeah, I think it's pretty bold. We want to integrate the whole care system. And, that's really the vision of Ontario Health and government. So I would say absolutely, it's very bold and ambitious.
Okay, so I think we'll maybe move along, but having said that, please do continue to put any questions in the Q&A box, because we can come back if you've got something lingering that you want to ask about the new strategic plan. We can certainly address those at the end. We'll have time at the end, but there aren't any other questions from the community right now. So maybe we'll move ahead to Elena's presentation.
Okay, thanks so much. And thanks everyone for your attention this evening again. And thanks for your questions that you've asked already and that you will continue to pose to us. I'll hand over the mic to Elena.
I'll just give it a minute to get my slides up.
Hey, good evening. As Joanne shared at the top of this session, I'm Elena Pacheco, the Chief Operating Officer and Vice President, leading the redevelopment of our Uxbridge campus. As many of you may already know, Oak Valley Health is a regional healthcare provider serving the people of Eastern York Region and North Durham with seamless access to care between our Markham-Stouffville Hospital, Uxbridge Hospital, and Reactivation Care Center site. Across our sites, we offer a variety of services, including diagnostic and emergency services, and deliver clinical programs in acute care medicine and surgery, addictions and mental health, and childbirth and children's services. We are also proud to be part of the Eastern York Region, North Durham, Ontario Health Team. This map shows our large catchment area, all the way up to Lake Simcoe and south in Scarborough, over to Vaughan in the west and Oshawa in the east. And as you can see from Stats Canada projections, both York and Durham region are looking at explosive growth over the next few decades. This is going to present a significant burden on health services and a catalyst for our ongoing response to meet the growing needs of the communities we care for. In April 2022, we received government approval for the new hospital to be built on existing land. And once complete, it'll be a brand new state-of-the-art building where patients will receive the highest quality of care and an extraordinary patient experience. Here's a snapshot of the timelines we're working with that will get us to shovels in the ground by fall 2024. This is where we will advance our preparation work for building the new hospital. I'll just give it 1 second to catch up. Thank you. The vision for the future Uxbridge campus is for a community health hub, including acute, ambulatory, emergency services, and primary care services. Oak Valley Health's master plan is for a united vision across both the Markham and Uxbridge hospital sites that are mutually supportive of one another. The first phase of redevelopment, the Oak Tree Medical Center, was built through a partnership between Uxbridge Health Center's physician group and Oak Valley Health, and opened in 2021 and will seamlessly connect to the future hospital. While the new hospital is under construction and during the transition to the new one, planning will ensure continuous services between the new hospital opening and the old one closing. Work continues on the opportunity of a long-term care home on the campus, and we will share more once that plan is confirmed. With a view to the future, the rebuild will support modern care procedures and technologies, including advanced infection control, and will support modernized care using state-of-the-art technologies. The new hospital will have greater diagnostic and laboratory capacity. A new cardiorespiratory clinic will include services such as a virtual cardiologist consultation. And with the addition of stress and pulmonary function testing capabilities, the cardiorespiratory clinic will support Durham residents for the early identification and intervention for heart disease. During construction of the new Uxbridge Hospital, access to the helipad located on the existing hospital property for air ambulance transportation of patients will not be permitted due to the surrounding construction activities. After an in-depth assessment, it was determined that in order to continue access to air ambulance services during construction of the new hospital, a temporary location within Uxbridge would be required and has since been confirmed. The temporary location is within the fields of Uxbridge, located approximately 3 kilometers from the hospital. The final location of the helipad at the new hospital will be on the rooftop of the hospital building, allowing for enhanced patient transport services. One of the initial milestones in the hospital's redevelopment project was implemented last week with the introduction of new patient and visitor parking facilities. Key features of the new parking facilities include increased capacity. The new parking area boasts a larger capacity to accommodate the growing number of patient and visitors, reducing congestion and easing access to the hospital premises. Accessibility. A dedicated accessibility lot has been created at the front of the hospital to better accommodate individuals with disabilities and convenient drop-off points near the hospital entrance. Safety measures, including gated entry, have been put in place to ensure the well-being of all individuals utilizing the parking facilities. Patients and visitors can continue to be dropped off at either the emergency department or main entrance prior to vehicles being parked in the new lot. A detailed map of the new parking lot can be found on the hospital website at oakvalleyhealth.ca. The introduction of these new parking facilities at Uxbridge Hospital is a step forward in the ongoing redevelopment efforts as part of our commitment to creating a more welcoming and efficient environment for all of those who rely on its services. We continue to focus on keeping our community informed and engaged all along the way with key tactics, including virtual town halls like the one we're doing tonight. We will continue to engage with and update the community via many opportunities, including our community newsletter, The Link, and our social media platforms. You can find the links to all of these key channels through our oakvalleyhealth.ca website. Also, on our site, we have developed a dedicated space for information on construction of the new hospital. With projects of this size and scope, many questions can arise, so we would encourage you to visit the site for accurate and timely updates.
Great, so I think we can jump to questions, Elena, but I may just go back to one slide because we had the PowerPoint freeze for a few minutes when you were talking to the current timeline. So I just wanted to show that because you did reference what we're working towards for the fall. So I just wanted to put this back up just so that everybody could see what you were speaking to, and then we can move to questions. We do have some more questions rolling in with relation to the strategy. So maybe we'll come off the PowerPoint, sharing that, and then we can have Joanne and Elena back on camera so that they can go ahead and answer those questions directly. So I'll start maybe with the strategic plan, Joanne. We can loop back to that, and then we'll look at some questions for the Uxbridge Hospital redevelopment. So Joanne, a good question around our vision and mission and how will we help address the primary care physician shortfall?
Oh, a really great question. I think that there's a lot of things that we're doing that can really assist with that, because as I mentioned, what we're really focused on is closing the gaps among the components of the system, one of them being primary and community care. And we have a number of initiatives that are focused around the work that our Ontario Health Team, or OHT, is doing. A couple of concrete examples. One is our Community Health Center in Stouffville, which focuses on supporting unattached, some pediatric urgent streams, and those who can't access primary care. So I think, that really helps support primary care as well as divert unnecessary visits to emergency department. Another example through the OHT work is the SCOPE program, which really helps provide access to specialist care. And that's something as hospital partners, we have good access to, and through the OHT work and what we're doing there, we can support primary care and community providers to access those services. So, there are many more examples, but I think that those are two concrete ones that demonstrate how the work we're doing helps close those gaps and can be very supportive to a really strained group of providers in primary care.
And another question, Joanne, along those lines, a little more about the community partners, but we've got a question here about more detail about who those community partners are. We've got community members interested in getting a list of those partners who help to deliver that integrated care.
Well, what I can tell you first off is we have a long list of partners. I mean, other hospitals, community service agencies, community service providers. The list is extremely long. We have a lot of partners through our OHT, many of whom operate in our case, because of our focus right now in the mental health and addiction space. But essentially what we do when we're seeking to partner, although we try to mine all of our partnerships all of the time so we maintain good relationships, is we focus on what problems we're trying to solve, what goals we're trying to achieve, what are the priorities, and then we look for providers who can best help us because of their knowledge, experience, and expertise with that issue. So for example, if we're trying to provide community-based service, we would look for community service providers and community service agencies who have expertise in that area, in that clinical area of focus, and we would seek to work directly with them.
And some of those would be listed through our OHT.
They would, and that's not an exhaustive list of all of our partners. So again, our partners are relevant to the clinical service area and the particular goal in question.
And then a follow-up to that, Joanne, if you could speak to accountability of the community partners to help achieve our strategic plan objectives.
Well, I mean, that's the beauty of a construct like the OHT. They're all accountable, and we do have a governance model overseeing that OHT structure. Elena may have some comments about that, but a part of that is identifying their commitment. What's the metric? How are we going to measure and actually oversee that? So anyone who partners with us is accountable for whatever service delivery we planned, and we have metrics to test that out.
Yeah, and I think you touched on all of that, Joanne. Definitely the key deliverables and then reporting out those metrics and targets that have been assigned.
Okay, great. So maybe we can shift gears a little bit to Uxbridge. I will post quickly some excitement. We've got an anonymous attendee saying so excited for the new Uxbridge Hospital. So I'll put that up in the chat. We are posting everything that comes in on the chat. And then maybe we'll start. We've got Councillor Bruce Garrett, who's actually joined us. That's one of our Durham Regional Councillors, and starting with a lovely message of support and then a question. So I'll read through that and then post that as well. So just from Councillor Garrett, I simply wanted to thank OVH for their commitment and assure you local and regional councils and all residents are fully supportive of this project. We also work closely with our colleagues in York Region. Can you speak to how York also benefits from the new Uxbridge Hospital?
Absolutely, I'll take that one, Courtney. So as part of the redevelopment, there is some growth in beds over at the Uxbridge Hospital site, which is excellent. We currently have 20. We are growing to 31 beds. I touched on a plan that we're working on for long-term care, and we'll share that information as we go through the process, but that will also help create capacity for York Region residents, Markham residents, and because it's one organization, there is a sort of bed allocation that we look at across the board. So we take an opportunity to really look at how we can gain capacity through the build at Uxbridge site.
And also just in terms of size, Elena, there's a good question here, and you touched on it earlier with the explosion of the population that we're looking at in growth for the Durham region. So a question here around, related to the shortage of medical physicians in Ontario and Canada, how do we plan to attract and grow staff to service the new, bigger hospital and population?
Did you want to take that one, Joanne, or did you want me to?
Yeah, I mean, I can certainly start. I think that we really believe that recruiting and keeping top talent, including physicians, is, the key is they want to work in an organization that aspires to be outstanding and to deliver exemplary care. And so we believe that will help us attain and keep top talent. We also have developed a people plan that's refreshed each year, because as I said earlier, without superb talent in people, none of this is achievable. So we have a plan that's very much focused on supporting and developing people, their well-being, their education, their ongoing support, etc. So I think, that's where I would start the conversation. Do you want to add to that?
Yeah, I do. When I was thinking about the question, I think about even maximizing roles, Joanne, even our partnerships that we're looking at from an academic standpoint, and attracting talent as well. So just some of the initiatives that we're looking at in terms of how do we maximize the scope of practice for nurse practitioners? How do we sort of build the partnerships with York University and University of Toronto and any other university that's sort of partnering for building that capacity as well as we move forward?
Yeah, and I mean, I agree with that wholeheartedly. New models, adoption of technology and innovation. People are really looking to and are inspired by an organization that, inspires excellence. and wants to be the best. And so I really believe, as you've heard already, that will really help us achieve our goals.
Okay, so we can take a few more questions. We've got some more time before we get to our final item, which is really a survey on feedback from the session and looking to topics that our community is interested in as we continue to host community virtual town halls. But Elena, one question that has come up, and I know you spoke to the timing in terms of the fall when we start really advancing our work to prepare the site for the official construction of the new hospital to begin. But once that does begin, how long do you expect the project will take before we actually open doors?
Yeah, so we can anticipate the project taking approximately 24 to 36 months. 36 months including the demolition of the existing hospital and then building some additional parking in that area. So that would be roughly the timeline for me.
Okay, great. So we don't have any additional questions coming in, but as Elena touched on and Joanne has referenced, there's lots of information available at oakvalleyhealth.ca, including where you can contact us for more information. We will be also following up with a survey, and maybe if we can go back to the PowerPoint, we can share that final survey code that we could then have you either scan right now to fill out. It will also be emailed to you directly tomorrow as a registrant of the session. Will be sending out a follow-up email. And you can please complete that because it's really helpful for us to know more about what was helpful, what information was helpful, and what additional information that you would look forward to hearing more about. And so maybe I'll hand that over to Joanne for a few final words.
Yeah, thank you, Courtney. So again, we really want and need your feedback. We'll leave the slide up for a couple of minutes to give you some time to capture the link as we say goodnight. And thank you all so much for joining us. And we hope to see you again in the not too distant future. So thank you and have a wonderful rest of evening.
Thank you.